Hey everybody, my name's Harvey Karp. I'm a pediatrician living in Los Angeles and very happy to be with you today. I hope you're all well and safe and still remembering about your social distancing and wearing your masks when you're out, both for protecting yourself and others and as an example to people who are watching. So everyone knows that we're all in this together and we're all making a sacrifice together to make our country stronger and get back on our feet. So we're going to be talking today about moms and babies and a little bit about how you make that adjustment when the baby comes into your home, what it's like. A lot of people, it's kind of odd today. People have babies. Sometimes they've never even held a baby in their lives. It's pretty strange. It's like, walking in a plane and saying, you've been in planes before, right? So you can fly this, right? I mean, just because you've seen babies doesn't mean that you know all the secrets. Not that it's rocket science, of course, and part of the fun that we'll be talking about today is that there are lots of tips and just kind of ways of thinking about things that can make the road easier for you and help you understand what's expected. So my work is based on a kind of a new idea, something that people didn't know about before, which is that babies are born with a very special reflex that is like, it's almost like an off switch for crying and an on switch for sleep. Actually, babies are born with a lot of reflexes, which are built-in abilities or built-in software. So they're born knowing how to cry and suck and swallow and blink and all these things that you would never be able to teach them if you tried teaching your baby, suck, no, suck, then swallow, but breathe in between. It just wouldn't work. So they have to be born with certain skills and capabilities. And those things help keep them alive. But what wasn't known before this work, Happy's Baby on the Block, came out, is that babies are also born with kind of an automatic response that can calm their crying and that can promote their sleep. And it's not really a mystery. It actually affects all of adults as well. We fall asleep in trains and planes and cars and things that move and make that rumbly sound. We like the sound of the wind and the ocean. But why? Why do we like those things? And that's part of the interesting story about how we got to where we are and what are the tricks and tips that are going to help you with caring for your baby. Now we're waiting for Dr. Verzin. Hey, there you are.
Hello.
Hi, good to meet you, Robin.
Great to meet you too, Dr. Karp. It's a pleasure.
Thank you. So we're just talking about having a baby and becoming a mom or a dad. And do you have kids yourself?
I do. I have a almost 4-month-old and I have a 3-year-old.
Oh my gosh. Okay, you're our demographic.
Yes, I'm right in it. And so many of our Parsley members are moms and going through fertility journeys, pregnancy. I saw patients this morning, and one of the patients I saw this morning is just entering her 2nd trimester with her 3rd, and says she feels like she's at the end of her 3rd trimester, but she's only in her 2nd. And so we were sort of unraveling some of the things that we could do to address her reflux and her insomnia and her inflammation. Mm-hmm. So you know how it goes. I don't have to tell you, you're the expert, but. No,
but it's a challenge. And of course, it's a common road, but everyone is on a slightly different road, right?
Yes.
And just because you've done one baby doesn't mean it's going to be exactly the same the next time. Easier things, harder things. You just have, I always tell my patients that if you were going to have any bumper sticker, it would say, be flexible or die, right? It's good to have an ideology.
It's a great adage for life.
Out the window. Yes. So, so we have a bunch of questions that people have sent in.
Awesome.
And I'll start with the first one I have here, and then we can kind of ping pong back and forth. So it says, why is my mood so all over the place after I have my baby? I'm still in the 4th trimester. And so the concept of the 4th trimester, it's kind of sounds a little funny that, you have your baby, you wait 9 months, you're done with your 2nd and your 3rd trimester, and you feel like probably after 8 months, you're ready to have the baby already. You're kind of finished with that. But the, excuse me. So the thing that people don't recognize is that even after you have the baby, it still is something that is like you need to consider yourself as if you're a walking uterus.
Yeah.
In other words, you're holding and you're rocking your baby. People used to be worried. They used to think, if I hold my baby too much, is that going to be upsetting to the child? Or am I going to teach them bad habits? But the fact of the matter is that that babies have 24/7 holding, rocking, and shushing. Yeah. And so in the womb, that is. And so when they're born, to be in this totally quiet room, flat bed, not moving, it's actually sensory depriving for babies. That's why anyone will tell you when you hold or rock a baby, that's when they relax and they love that.
Yeah, so, I know. I'm seeing that with my daughter right now. She's, you know, she's just, you pick her up and they just instant smile, right, of that 4-month-old. And then, you know, she has her brother around, racing around and being really loud. And so, we keep them in the same room because I think it's just really nice and stimulating for her to hear him, and he loves to like hug her, and it's absolutely adorable. But I think, you know, in all of that, having just gone through the 4th trimester myself, hi Poppy Seed Health, I know you guys, you know, the reality for a lot of our moms is that they're sleep deprived, which is one reason mood is all over the place. Oftentimes there's actually an issue that I see frequently, is dehydration and breastfeeding. So oftentimes moms think they're keeping up with the water and they're not. There's also a lot of anxiety around breastfeeding. And then there's the obvious, which is you add all of that, you're healing from a major physical event, whether you've had a section or you've
and psychological event, yeah.
Major physical and psychological event, in which, you know, you sort of, I always say, like, you leave the hospital, even during pregnancy, you know, your OB is really there focused on baby and often not focused on mom. So like we do testing during pregnancy around thyroid, around nutrients, looking at things that like kind of get forgotten for mom during pregnancy. But then afterwards, you may have had blood loss, you may be depleted, you may have been anemic. So your body's sort of trying to heal and rebuild, and you're adjusting to this new normal. And then your hormones are constantly shifting. So change is the new normal when it comes to your hormones after you deliver. And so there's so much. And so for people who have an underlying history of either depression or anxiety, it can be a huge trigger, almost like a trigger for somebody who has PTSD in another sense, right? And so it can be a real trigger for that. And then for other women for whom they're totally new, they haven't had those types of, you know, emotions, at least clinically before and in a longer term way. It can really just set it off for them, and then they don't know how to deal with those emotions. And it's funny, you go to your OB, you know, a couple weeks after, because of coronavirus. In my case, I didn't, and I'm also a doctor. I'm like one of those horrible patients. I know too much, so I won't go, right? But having been through it the first time with my son, the visits after, it's, you know, they sort of ask you a couple questions, check the box. Are you okay? And there's not really a lot of focus on how are you doing? How is your health? What are you doing to support your health? And so I think in the entire pregnancy and childbirth process, and in this 4th trimester that we're talking about now, the woman gets lost, right? Yeah. And so sometimes at Parsley, what we're doing, because we're not the pediatrician, right? We do have a small pediatrics practice in New York, by the way. If you're in New York, you want pediatrician from Parsley, we'll do it. But otherwise, we really are focused on the adult. We see men and women, but a lot of our members are women. And so we're the ones like focused on mom. And mom has gotten lost in this process. And I think that can also be a big part of it today.
Well, there's a lot to unpack there. And I think that's a really great introduction. I would actually take one step back and even setting the scene, let people know that their expectations for most people when they're having a baby are, you know, I'm going to do this, I'm going to breastfeed, I'm going to take care of my baby, I'm going to really be the best mom who ever lived, and I'm really going to dedicate myself to this. I've been waiting a long time. But what they don't realize is that taking care of a baby, like 2 parents and a child, or even 1 parent and a child, is the most bizarre family that ever existed. The nuclear family, actually the nuclear family and the nuclear bomb, both those ideas came about at the same time. And they're both pretty destructive. Up until 100 years ago, you always had 5 nannies, right? You had your grandmother, your aunt, your older sister. And so doing it all on your own, not that you can't, you just should be patting yourselves on the back and recognize that this is hard work. And especially in your case where you've got a toddler as well. Nobody ever did that before, especially if you're locked up in an apartment, you know, and you're not allowed to go outside and bring people inside to help you. So it's important as a first step for people to kind of stop having too high expectations of themselves, kind of lower the sights a little bit and just be recognizing the fact that it's going to be, it's challenging, it's tiresome those first months when you're doing it all your own, and you should reach out for help.
Yeah, you know, it's funny. You're the second person to bring this up this week. I was actually talking to Esther Perel this week, for those of you who know she is. And we were talking about how this idea that we do take for granted that, you know, you and your partner, if you have a partner and your toddler and your infant are all together. And we were talking about this very topic. She asked me, you know, who is in your life who's like involved? And of course we're like, oh, our parents are great and we have all these friends. And she's like, no, who can you leave your children with who will take care of them as well, if not better than you? And of course, my husband and I look at each other, and no knock to our lovely parents or our lovely friends, but the friends are stopping by at the birthday party, or are certainly there for me over text message, or any way I want to talk to them. But I'm not leaving my kids with my friends, and I'm not leaving them for long periods of time with even my parents, who are wonderful. And so, you know, this nuclear family is an adage of this new age that doesn't frankly work. And so it's not a weakness. Can you do it? Yeah. But is it the ideal way? No. And so figuring out how we can kind of band together and give each other support is so critical.
Right. And you help others. This is the time to receive help. And don't feel like you're deficient because you need the help. And then you know what? You're going to give it back 2 months, 6 months, 3 years from now when somebody else needs it, and you'll pass it forward at that point in time. That's really the kind of the best way to think about it, I think.
Definitely.
Yeah. But then you brought up 2 other points which have to do with critical jobs of a new parent. And I usually think that there are 3 critical jobs. There is feeding your baby, calming the crying, and getting sleep. Honestly, changing the diaper and doing a bath, those things are pretty, you figure it out pretty quickly. Yeah. But crying, exhaustion, and feeding are the things that really become the pebble in your shoe if you're not able to accomplish it. Right. So breastfeeding, number 1. Of course, there's a lot of, not everyone gets to breastfeed. Of course, it's the best thing for the baby and the mother if you can do it. And there's a lot of support for breastfeeding. And don't wait till you're breastfeeding to reach out for support. Do it when you're pregnant, right? Don't you agree?
This is such an important topic. I was like 8 months pregnant in an elevator in New York City, and a woman saw me and she said, oh, having the baby is the easy part, but someone should warn you about breastfeeding. And I sort of like looked at her like, who is this lady? Why does she leave me alone? And then I hit it, and having the baby, as hard as that was the easy part. And for me, breastfeeding with my first was really hard. Went through the whole tongue tie snip, which I'm curious to your thoughts on. I don't really buy it. Did not help me. And went through, I was working really early as a physician and entrepreneur. I was running around. I was traveling. Breastfeeding was really, really hard for me. And I almost exclusively pumped with my first, despite getting help from a bunch of lactation consultants. And then in this case with my second, I've had, as it goes, a much easier time breastfeeding, but only in part because I sort of found this incredible lactation consultant who helped me, and we finally got it.
What was the tip that helped you? What was the information that helped you?
You know what was interesting? It wasn't information. It was, she came over to my house. She took videos of me doing it wrong, or wrong for me. It wasn't working, so it was wrong, right? It's not a right or a wrong. It was not working well. I was in pain. My nipples were starting to get damaged. Once they get pretty damaged, it can be really difficult. Yeah. As I had learned with my first, where I'd just given up and just pumped exclusively. And so she took videos, and then she showed me different positions, and she actually then videotaped me with my phone so that I could then see myself in the right position. This is Baby in the Family, by the way. You can all follow her. You know what? And then I had the videos to watch, and then I could text with her. And so the service went on much like a Parsley membership. It went on past that initial moment because you know what? You're in a fog, you forget. And she really taught me new positions and ways to latch, and sort of how to form the taco with your peace sign fingers with your nipple to get that latch in, how to not press the baby's head into my nipple, but really the upper back. to support. And some of these things are obvious and you can read them, or you can have somebody show you once, but it was the way that she actually used technology, quite frankly. And then ongoing communication. I wasn't then just lost.
Sure.
And so I think that that was really part of it. And so we, you know, at Parsley, we're really big on two things. One, our pregnant patients who are new, especially the ones who are first-time moms, but even second-time, who like me didn't figure it out the first time. Getting help with breastfeeding and really learning about it before you deliver. I think that's excellent advice, Dr. Karp. And then the second,
and fortunately, most women don't have to go through everything that you went through. And most women, you know, when you think about it, you go, it's very natural, isn't it? We've been doing it for millions of years, but, and it is, once you get the hang of it and once the baby gets the hang of it. And when you've seen it, you know, with 20 of your friends and you've really watched it, which we don't do in our culture. But there are a couple of things that people should know to kind of steer them clear of difficulties. And the first thing that I always tell people is when you're pregnant, check your nipples, stimulate them a little bit, and see do you have flat or inverted nipples. That's the first thing to check for, because if they're flat when you stimulate them, if they don't erect at least like a half an inch, or if they pull in, you're going to have problems, because when the breasts fill with milk, there's not going to be anything for the baby to latch onto. There's not going to be a nipple that they can kind of secure in the mouth. So that's a super easy thing to do. And then there are things we can do to get the nipple to kind of stretch and to be prepared for the breastfeeding. You want to do that a couple of months even before the baby is born. So that's the first thing. And the second thing is to read or speak to a lactation consultant or La Leche League and learn about what it is that you're going to be doing. And the number one tip that you need to know is that the baby, it isn't like you let the baby take the nipple. You have, it's kind of like jumping rope. When you jump rope, you watch it. No, could have gone then. Could have gone, and then the third time you just go for it. And it's really kind of fast. And so with the breastfeeding, you're so in a hurry to get the baby on the breast, but actually the first thing you want to do is watch the baby's mouth, and you touch the upper lip with the baby's upper lip with your nipple, and the baby kind of opens the mouth a little bit and then closes, and you do it again. They open. By the fourth time, they kind of open it wide for an extra few seconds, and then you bring the baby on. But look at this: the nipple is right under the upper lip, away from the tongue. If the mouth is closed, the tongue is rubbing the nipple, and that's what gives you sore and cracked nipples. If the nose is too far away because you're trying to protect your baby from suffocating, that throws the tongue up to the nipple, and that makes it raw. So you kind of want to make sure that the mouth is open, the nipple is high in the palate, the tongue is away, and the nose just touches the breast. So it's not buried in there, but it's not too far away either. Yeah,
I love those tips. Another one is pulling their cheek like this a little bit to get them off if they've latched on too shallow and they're chomping. You know, with my first, I was like jamming my little finger in his poor little mouth and trying to like unlock his little jaws. I felt so bad. And if you just pull, my lactation consultant called it the Elvis, you know, you can just Elvis them right off with this little, like just pulling their cheek, and it's so easy. And then the other thing, I was convinced that you know, once I had some cracking that I was done, it was over. And she really showed me that the nipple can heal while you're still breastfeeding if you then get the latch right. And that taco move where you squeeze the nipple with your piece, not actually the nipple, the key with the taco with your piece fingers of squeezing your breast, squeeze the skin around the nipple behind it. But so often women are squeezing the nipple itself, trying to get it in the baby's mouth, and then you're automatically going to be too shallow. So make sure your peace sign, you're squeezing the nipple, is on the skin outside of the areola,
the areola.
The dark part. Those two things were so helpful with getting that latch, and then it was really game changing. And these little things can, like, you know, help you do it. But you
even letting breast milk dry on the nipple. Breast milk is very healing for the skin, and actually it will help your cracks and your sores heal up faster. But there you go. If you're having trouble, don't be shy about reaching out, right? Because people can help you.
People can help you. And also, we don't, you know, help our friends. After that, I showed all these moves to one of my friends, and then I changed her, you know, breastfeeding journey. And at Parsley, we have like documents based on this where we give
There
our
you go.
patients, because we
You're
want,
sharing the dance moves.
you got to push it, pay it forward, right?
Yeah. So the other big thing is sleep, right? Exhaustion. That's actually what parents say is the number one stressor for them. How do I get my baby to sleep better? How do I get more sleep? Is it even possible? And as a pediatrician, what I think is so confusing about what we tell people is we say, look, first 4 months, 5 months, everyone knows the baby's not going to sleep a lot in the beginning, right? And you figure, well, all right, they're not going to sleep a lot, but then it's going to get better and better and better. And by 5, 6 months, they'll be sleeping through the night. And that happens maybe 10 or 20% of the time, maybe 30%. More often than not, sleep is a roller coaster. It's better, then you get a growth spurt or sleep regression or teething or cold, and everything falls apart again. And so that's why sleep can be such a challenge for the parents. And the babies are fine. They don't care. They're awake and asleep and awake and asleep. We're the ones who really struggle and suffer with that. But here's the curious thing. We tell people that, you just have to wait. It's going to be months and then the baby will establish a better sleep pattern. But at the same time, we tell people, you know what? If your baby's not sleeping well, you know what you can do? Go for a car ride for a couple of hours. Your baby's going to sleep in the back seat and you're going to get, the baby calm and quiet. And if you drove like all night long in your car, your baby would sleep an extra hour or two. It's just what they do, right?
Right.
So it turns out that we actually can help babies sleep if we do some of this rhythmic stuff, which is basically imitating the womb. That's why we call it the 4th trimester, because you're imitating the womb experience for helping these babies to make the transition from 24 hours a day having womb experience to just, 12 or 16 hours a day having that womb experience.
Yep, absolutely. No, I know. I mean, it's when we see in our moms, right, they're starting to question themselves, right, when baby's not sleeping. And so, as the mom doctor on our end of the spectrum, we're really focused on, first of all, just tactics that can help get mom sleeping. When women hear like baby sleeps, you sleep, but if you're like me, you don't take that seriously. And so you don't actually do it. And so getting extra sleep is critical. I always tell our moms as well, like baby will kind of be on your schedule. So I see a lot of parents sort of accept that baby is now dictating every moment of my life and my day. Yeah. And we tend to, in our house, have like the more, I don't know if it's European or not. That's how we describe it. Maybe we're just flattering ourselves, but we sort of say, baby's here for our journey. They're going to be great. We're there along for our ride. Right. So let's get them used to our normal and our schedule. And my last tactic for baby sleeping is just feeding them right before their bedtime. Getting them tanked up is a good way to keep them asleep. But for mom, what we see a lot is women not really realizing how sleep deprived that they are.
Sure.
And they are walking into things. I've seen women fall, have dizziness, think that they have vertigo, depression and anxiety are certainly part of it. And we have no set, like, you should sleep train, you shouldn't sleep train. Like, that's a really personal decision. And so we help women kind of navigate that wherever they are in that spectrum. Right. But what we do say, and especially women who are like 6 months to a year out who are still not sleeping and they're starting to crumble, when they're my patient, I say, listen, like, I'm not here to tell you how to parent or tell you how to take care of your baby, but you can't be sleep deprived for this long, or you're going to be falling apart. So how can we help you get sleeping, whether it's taking magnesium glycinate, whether it's switching on and off nights with your partner so that you can get some full night's sleep? Because chronic sleep deprivation can lead to not only mental health issues, but adrenal fatigue and a whole host of other problems, metabolic issues. Women will say, I can't lose the weight.
Yeah.
And I'm like, you're not sleeping. You're not going to lose weight if you're not sleeping, period.
That's exactly right. And so, but let's go back really to those first months, because it turns out there's a big lie. And the big lie is that you can't help your baby sleep longer and be more regular sleepers. You can. Like I said, if you just drive them all night in the car, they're automatically going to be better sleepers. So we've now done the largest sleep study ever done on babies, over 7,000 babies, using a bed called SNOO, which is a bed that rocks and shushes babies. It also swaddles them securely so that they stay on their back. Actually, we just celebrated yesterday. We just passed our 100 million hours of keeping babies safely on the back since we came out with Snoo about 3 years ago. So, so it turns out that in the womb, the baby has sound that's louder than a vacuum cleaner. They're constantly held and rocked. And in fact, when you go to sleep at night, they wake up, and that's when they start kicking. So when you put the baby in Snoo, it rocks and shushes the baby all night, keeps the baby securely on the back. And if the baby gets upset and starts to cry, the bed senses that and responds with a little bit more motion and sound. Half the time, it'll put the baby to sleep in the middle of the night, and you may not even wake up. You may not even hear it because the bed works so quickly. And then half the time, the bed won't put the baby to sleep because the baby's hungry or needs a diaper change. And so then you get the signal. And what's cool about that is it turns out that we can sleep train babies much earlier than was thought possible without doing any crying at all, just by using the cues that babies are used to in the womb. And that becomes the real key aha moment, which is that you sleep with a bed and a pillow and your favorite sheets maybe, or favorite comforter. You could sleep on the floor, on a cement floor, but you won't sleep well. And babies can sleep on their back looking up at the lights in a totally quiet, still room, but they're not going to sleep well. And so now we rent these beds for under $4 a day. So it's pretty much a Starbucks coffee, you know, to have the safest bed. It sleep trains babies. And it's a 24-hour, 7-day-a-week helper, because when you need to shower, take care of your toddler, fix dinner, the bed is responding. So it's like an extra pair of hands.
That's awesome. I love that. Yes, because we're not going to drive all night. Yeah, it's hopefully. Babies. I always tell our moms, you know, they'll say, a lot of moms have this thing where once the baby starts sleeping, they like still are waking up. And I remind them that like babies can sleep. And babies can sleep healthfully. And if they're sleeping, then you can be sleeping, right? So like once mom is sleeping through the night, I have a lot of moms who are really afraid to start sleeping through the night because they're afraid their milk supply is going to crash. And no, you can't go like 12 hours. But you know, I've been blessed with pretty good sleepers in my house. Both have slept on their own, basically around 8 or 10 weeks. But you know, I've always been afraid that my milk supply is going to go away. But once the baby starts sleeping through the night, you do that pump or that feed right before they go to bed or right before you go to bed. And then you sleep on through the night. You get that 7 hours, 7.5 hours, and then you feed in the morning, and your milk supply, as long as you stay hydrated and you pump or feed enough during the day, it will keep up. And so when women are stuck in this not sleeping, even after babies probably happily sleeping in their Snoo, holding on to that. So that's where we come in and try to say,
don't worry about that. Yes.
You've got to not worry about it. You got to start sleeping yourself, right?
Right. And the breasts are amazing that way. They will make milk when you need it. I mean, if you have twins, okay, I'll make enough for twins. If you need to be more feeding during the day and less at night, which is the normal trend, it doesn't happen overnight, like you say, but over the period of a couple of weeks, you can start training the breast to make less milk during the day, and they will make more at night. They'll compensate for you. And in fact, that's where you don't want to be infant-led, which is during the day. If your baby is sleeping more than an hour and a half or 2 hours during the day, wake them up, do a feeding. Because babies only eat a certain amount every 24 hours. And if they're not eating it during the day, hello, they're going to wake up and want it at night. And so you literally can shift their schedule to get them more in a daytime schedule, which is, you know, better for most of us because that's the schedule we live on.
Yeah, absolutely. No, you got to get them on your schedule. So we set a feeding schedule pretty regularly in our house early on. And that also is what lets us then get that nighttime sleep of 7.5 hours at least, right? Because then someone asked if it can cause mastitis. You know, sometimes you can get blocked up that way. If you feel like that's happening, you can use the pump to get something out or get baby to feed. But usually, like Dr. Karp is saying, if you do it a little bit and you kind of ease into it, your body actually does adjust. And then you can make that milk during the day and give it to baby.
And when you do feel very full and you want to pump out a little bit, you don't have to pump every single drop. Take out the first ounce or two. So you relieve the pressure, but you're still giving the breast the signal that, you know what, during this part of the day, I want you to kind of reduce it a little bit. And then the breast will follow that command. But if you pump out every single drop, then they think that you did just have twins and they're going to actually make more milk and you're going to be going in the other direction.
That's a great point, and it's also a good point for weaning. Like sometimes I find moms get stuck in this mode when they're ready to wean, and then their breasts are making too much milk, and then they're like, well, I had to pump it because, or I had to feed because my breasts were too full and I was worried about mastitis. And that's the same thing. You can pump a little bit or feed a little bit at that moment to give yourself some relief, or hand express if that works for you, someone points out. But yeah, don't sit there for half an hour and pump out 4 ounces, because then guess what? You're sort of back to at square zero. So you sort of have to train your breast like you train your baby.
You know, Robin, it's still May, the month of May, which is Maternal Mental Health Month, or Postpartum Depression Awareness Month. And maybe we can just say a little bit about that. The thing I would want people to know is that it's common. About 15% of all moms, and many dads actually, experience postpartum depression or anxiety, may even be up to 20%. A study done in Canada showed that it was 24% of new mothers had depression or anxiety in the months after the baby was born. And when you think depression, you think of sadness, you think of boohoo crying and that kind of thing, which it definitely can be. But for many more people, it's anxiety. It's like you can't turn your brain off. It's obsessive thinking. It's intrusive thoughts like, I have to get out of here, or maybe I'm going to drop the baby. I don't want to drop the baby. Maybe I'm going to do it. And it is checking your baby over and over, worried that you're not doing the job well. So it isn't always the that's what fools women sometimes. They think it's, I'm not crying all the time, but I just don't feel good, and I don't feel attached to or bonded to the baby. And those can be symptoms. And the good news is, well, the one thing that people used to say is that depression is really related to hormonal changes. And certainly hormonal changes have an effect. But it turns out many studies show the key triggers for postpartum depression are 3 things: exhaustion, crying babies that you can't calm down, and feeling like there's no one there to help you. And so learning how to help your baby sleep better and cry less. And snoo is a great way to do it, but you may not have a snoo. You can do other things. You can use white noise, like a white noise machine or a white noise app. You can use swaddling to make the baby feel cozy. Those are ways of giving the baby at least some of the womb sensations, because if the baby can sleep better, you're going to sleep better. And all of that moves you in a healthier direction, and especially mental and physical health.
Yeah. Yeah, I see the same things, you know, so much undiagnosed anxiety and depression. And with all these stats, I always think about how much of it is diagnosed. Means diagnosed, guys, is doctor gives it a name, fancy word, right? But if you're having these symptoms, you know, a lot of people tell themselves, oh, it's not that bad. They don't get help. They don't admit to their partner or their friends. We see this a lot, that they're having some of these emotions because they feel like they're a bad parent or a bad mom. And so people really get fearful. And so that is something that, you know, is my kind of biggest message here, is that these emotions are completely normal. Most people experience them in some form. Now, for some people, it might be a day or two. And for other people, it might be ongoing in a way that's really disruptive. But regardless, like, speak up and talk about it, because it's completely normal. The sleep deprivation, the dehydration, erratic eating patterns. Some moms like kind of forget to eat regularly because they're often off of a schedule. So blood sugar issues we see coming up. We also see, you know, in pregnancy, because of the progesterone levels, a lot of autoimmune and inflammatory conditions go quiet. And postpartum, we see the autoimmune flare over and over again. And so the autoimmune flare and inflammation can actually be, it's not the hormone shift itself, but it's the autoimmune flare. We also see, you know,
people use omega-3s. Omega-3s can be so helpful.
Huge,
for that.
Super helpful. So if your prenatal doesn't have an omega-3 in it, get Parsley's or get one that does, because tanking that up is important during pregnancy, but then also after. Women forget your baby is sucking out all of those good omega-3 fatty acids, and you need to replete yourself. You need to make sure you're still putting in. So this is such an awesome conversation. Thank you so much for having me today, Dr. Karp. You're just such an inspiration. So I'm thrilled to
it's such a pleasure talking with
virtually meet you. I want to share with just your community that we created a special code. It's THB, the happiest baby, THB 150 for your first month free with Parsley Health. So sign up if you guys are looking for that. We're big fans of the SNU, and we're big fans of your work at Parsley, and make sure all of our moms know about both. But thank you for this conversation today. I feel like we're doctor nerding out here, people. We could talk about this stuff all day. You all go home and we'll just keep talking about it. But
I mean, we're like, that's the joke. I mean, when you're talking about young families, we are half doctor and half grandmother, actually, because a lot of what we're talking about is what your grandma would have told you, you know, way back when.
Right.
Anyway, pleasure to meet you.
Pleasure to meet you. Thank you. Have a wonderful day. Bye, everyone.
Stay safe, everybody.
Stay safe.